Hi, it's Dr. Nishtha. We'll be having a conversation with our FMG scholars who have done exceedingly well. We have Dr. Balvinder, Dr. Puneet and Dr. Amulaya.
Myself Dr. Balvinder. I did my MBBS from Nanjing University of Chinese Medicine and I got a score of 212 in recently conducted FMGE January 2023 examination. And right now I'm doing internship from PGIMS Rohtak.
Hello everyone, I am Dr. Puneet Sardana. I did my MBBS from Philippines and my score was 232 in June FMGE examination in 2021.
I am Dr. Amulaya. I graduated from Volgograd State Medical University in Russia. I cleared the FMGE 2022 June examination and I scored 210. Right now I am doing my internship at Government Medical College, Amritsar.
Great to have you here. So it is around only 20-25 days left for the upcoming FMG. So what you did just before your 20-25 days?
1 month before the exam.
Yeah.
Actually, first of all, I want to say start early. Then you will going to complete the syllabus early. Just like for me, I completed the main course from PrepLadder like 1 year before the exam. So I had like total 1 year for the revision. I started the revisions. Like till the exam, I completed 5 to 6 revisions easily. I remember whenever I even sit to eat something, I just play the rapid revision video, any short subject like psychiatry, dharma, and you just need to watch because you have already gone through the main videos and notes. At the last, just before the exam, you need to do as many questions as possible. Don't do any new thing. And doing questions, your mind will get habited to solving questions. You just look at the questions and get to that. Your mind will know the trick, which part of the 5-line question I should look at. In limited amount of time, and you get to reach the answer very quickly and easily. So at last, every day like 300-400 questions, like minimum I used to do in the last.
This is a good number.
Like don't be overconfident that ये questions तो मैंने पहले किया हुआ है, ये दोबारा आ गया. Just mark it. 10 seconds are not a big deal. Just mark it. You are revising that, and you doesn't know that the same questions can be in the exam.
Guys, it is very important to revise your question notes. I've seen people just revise their notes again and again and they don't go back to the Q bank. They don't see the Q bank that what mistakes they have done previously. So like what did you do while you were solving the Q bank again? Did you only did the bookmark questions or the whole Q bank again in that case?
Bookmark questions.
Okay.
Because like if I know some concept that I know by heart, I try to do that. But if I had made some mistake, then I'll go back and look at it again so that I will not repeat that mistake. But now at this point of time, every student is in their own boat. So like a different point of preparation, I must say. So होता क्या है कि कोई स्टूडेंट है जिसने अभी बिल्कुल भी इतना ज़्यादा प्रिपेयर नहीं किया है, what they should do is key revision videos complete करके and alongside they should do Q bank. And अगर किसी ने कुछ सब्जेक्ट्स अच्छे से करनी है तो they should try to do other subjects revision video से and साथ साथ Q bank. और जिनका अगर अच्छे से प्रिपरेशन हो रखा है तो they should revise from their own notes and alongside they should do Q bank. So Q bank तो सबको ही करना चाहिए at this point of time. लेकिन बाकी स्टूडेंट्स का प्रिपरेशन it will vary कि किसने कितना किया है.
This was very important because जैसे exam is around the corner, students used to get running towards each of the sources. Like कि उन्होंने जहाँ पे उनके main notes बने हुए हैं उसके अलावा भी वो और sources की तरफ जा रहे हैं just to gather extra information. Is it helpful or re-revising the original notes, the own-made notes, that is more helpful according to you?
Saying re-revising the notes.
Okay.
Because when you go to another platform, the like even a book to book, it's different. The material is different. Like it's differently worded. You have to apply a lot of brain power in reading, in understanding, and you'll be like, and if you find, God forbid you find a different fact, you'll be like, oh my God, I didn't read this. I don't know the word is ending. I don't know this. I don't know that. So it will like only dampen your confidence. So basically, what I did was I was a student who actually just like I didn't know. So I didn't really see any rapid revision except internal medicine. That's all I did. And I prepared the 4 exams. How I did was I read the notes. Like I used to sit in the morning. I can like sit through because of how it was in Russia. So what I did was I used to sit through and read the notes, go through them once, the rapid revision notes. And in one sitting you study 50, 100 pages. Once it's done, that's it. And then I used to solve the Q banks of another subject. Like the subjects that I did not read any notes of, like ophthalmology, ENT, and all that. I did 100% of the PrepLadder Q bank. Like even if I did not read the notes of the subject, even though I did not prepare it, I did not open a single book, I did the Q banks of that because I knew that even though I have not prepared, it's still going to be there. What will I do then? So, this is it. And my advice to students is that do not fret. Do not fret. Even though your subjects are not complete, even though your syllabus is not complete, this is an exam. And just do the Q banks. You will be prepared. Trust me on this. I did the same. And I know a lot of students who did the same. They focused on Q banks. And do not wander to various books. Oh, this is a controversial question. This is a controversial question.
Yeah.
Out of 300, only 10 will be controversial questions. That's it.
They don't decide your rank, right?
Yes, exactly. They don't decide your rank. Anyway, your mind, especially if you're the student who is not starting the syllabus, your mind should not be, oh, I want to be in merit and I want 270 score or something. No. In your mind, you should be thinking, I have to qualify. And what do I need? How should I utilize my time? Basically, Q banks definitely are revision. The minute you shift your focus on what do I have to do rather than what will the outcome will be, when you think in the present and not in the future, everything will change. Trust me on this. This is how I did it. It was people used to come and tell me that I don't think you can do it. I don't think you can do it. There's you still haven't started. I was kept reading, and they said that, oh, I still haven't started. And like, oh, you're a fool. You don't know what you're doing, this exam stuff, blah, 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 blah. And you know what I thought? That I know. Because PrepLadder pulled me through. I know because I used the app. I knew it. This is the thing that will pull me through it. Q banks and rapid revision.
So guys, this is a motivation for all the students who are starting late. So she is the one of inspiration and idol, which you can see. If you are starting late, you should not be scared. You should give your exam honestly. And I think the confidence is the key. If you are confident, half of the questions will definitely mark right. And if you are underconfident, if you have read also, you'll be again juggling with the options and you'll mark it wrong. And have you felt the same questions, the same images, they have been repeated in the exam which you used to do in your Q bank?
Which I gave in January 2023.
Yeah.
For sure, there were many images like CMV, Amulaya appearance, and many very common.
Just straight from the Q bank.
Straight from the one or two questions from the CMV topic and Amulaya appearance. They have been asked twice in the different languages of the questions. So the same exact images can be there in the exam. So don't neglect any image-based questions because people do just PYQs. Also focus on IBQs. And one more important thing I want to add is that around एक महीना बचा होगा एग्ज़ाम में, तो आप किसी भी सब्जेक्ट से डरे ना. You shouldn't be afraid of any subject till now because examiner is also not afraid of any subject. वो देगा हर सब्जेक्ट से क्वेश्चंस. तो एग्ज़ाम में फेस करने से बढ़िया है अभी कर लो. जिस भी सब्जेक्ट से आपको क्वेश्चन से डर लगता है अभी उसका क्यू बैंक उठा लो और you should be start practicing questions from that particular subject because at least you're gonna gain some knowledge and nobody knows the same question can be in the exam. So जिस भी चीज़ से डर लगता है एग्जाम से पहले at least face that situation once, twice, or how many times you want. Even if you are afraid of GT, just give it. You are afraid of anything, just do it because in the exam you can't take risk of seeing that thing for the first time. At least you have seen that thing quite a few number of times before.
Yeah. So how beneficial were the previous year questions in the Q bank itself?
Previous year questions, basically the concept that is tested is same.
Okay.
But most of.
But were they repeated exactly? Same in the FMG pattern?
I would say exactly. Image exactly aa sakti hai same, but the scenario, the way they frame it is different.
I think this is very important because आजकल students they are mugging up the previous year questions as if कि it will be asked exactly दोबारा in the same. They are not understanding the concept. They don't understanding the question. They are just mugging up the answer.
Right. They should understand the concept, what the question is trying to tell you, and you will get the answers right. And also I'd like to mention about the scenarios that are discussed as a special mention about Dr. Marwa. Whenever he teaches, he gives us case scenarios, like if he's explaining any topic and he has seen that sort of patient, he will discuss कि मैंने ऐसा केस देखा and I did this examination. तो वो चीज़ माइंड में फिट हो जाती है, इंटरेस्टिंग बन जाता है. एंड वही चीज़ आपको आपके क्लिनिकल सिनेरियोज में भी दिख सकता है हॉस्पिटल में. और बेसिकली हमारे एग्जाम में कॉमन चीज़ें पूछी जाती हैं. अभी वी रीड 1000 नंबर ऑफ सिंड्रोम्स, लेकिन वो पूछे नहीं जाते, राइट. हमसे कॉमन चीज़ें ही पूछी जाती हैं जो हमें डेली हॉस्पिटल में देखने को मिलती है.
Because examiner is also a doctor. He must be asking the questions which he seeing in front of himself, ना. तो जो भी बच्चे घबराते हैं कि ये सिंड्रोम नहीं आता, मैं वो सिंड्रोम भूल रहे हैं, तो इतना स्ट्रेस मत लो आप. जस्ट गो ऑन द कॉमन टॉपिक्स. अगर आपको MI एंजाइना नहीं आता, जस्ट डोंट गो टू वर्मर सिंड्रोम एंड ऑल. फॉर एग्जांपल कि जस्ट रीड ऑन द कॉमन टॉपिक्स. But now I think the students are even more scared because now they'll give FMG and then next is around the corner. We have read the guidelines of next that it will be occurring this year. So what will be the approach? अब कैसे approach change होगी students के लिए?
I feel like the approach for FMG students, it should be like QBank clinical scenarios integrated for next and for FMG, like, you know. And if there are some students out there who are preparing for USMLE or like UPMLE or anything, the same. Focus on your clinical stuff. Focus on clinical guidelines. How are you going to like develop the aptitude to solve the MCQ? What is the question trying to ask you, basically? And this will develop only with practice, of course. And also, I want to mention this one thing: time management. That how students should like, you know, really utilize the time that they're doing their QBanks. Because when you're sitting at home, it's like, oh yeah, it's fine. Time yourself, because this is the one thing that we know everything in the world. But if you're not able to finish the exam in time, what's the point of it? So this is like the one thing that I really want to stress on, that when you give your mock test, or even when you do your QBank, the modules, only 15 questions, 20 questions, you know, still time them, because this really help you evaluate
or solve just like you will be solving an exam.
Exactly.
Correct? I think this will be more beneficial because now students, when they are preparing, they just solve like this. They don't review them properly. They don't see what are the incorrect, and then they come up with the same mistakes again and again. And I've seen thousands of students, they are complaining that same mistakes have been repeated again in the same GTs and mock tests. We have done the same mistakes, and how to change them, how to correct them, just because they are not reviewing their questions only. See, but abhi jaise next hoga, so should they prepare for both the exams in a different way? Should the approach should be similar or different?
Actually, quite a few years back, FMG exam was full of one-liners, maybe. But we FMGs actually from 1 or 2 years are already oriented towards clinical questions. Because August 2020 exam was the first FMG exam full of clinical questions. After that, all the FMG exams were on the same level, though they're quite like 60-70% full of clinical questions. So I think for FMGs, the strategy shouldn't be changed much, because we are already on the right track, and we are the PrepLadder also has oriented itself these days according to upcoming scenarios and added more integrated information and clinical scenarios.
Yeah.
So any upcoming aspirant could just follow this platform.
As Dr. Balvinder has mentioned about the next and FMG, so my point is कि दोनों की preparation as such में कोई difference नहीं होना चाहिए. The approach must be same कि हमें clinical पढ़ना है, हमें सारी चीज़ें पढ़नी है, रिवीजन अच्छे से करना है, that everybody knows. लेकिन अभी हमें हमारा वैसा mindset बनाना पड़ेगा और हमारी हैबिट चेंज करनी पड़ेगी. If we are appearing for next, especially for upcoming students जिनको नीट पीजी का चांस नहीं मिलेगा, तो उनको उसी तरह से अभी से ही प्रिपरेशन स्टार्ट कर देनी चाहिए, क्योंकि जितने जल्दी हम उस चीज़ के लिए रेडी रहेंगे उतना बेटर हम परफॉर्म करें.
ओके, सो इसका मतलब कि नहीं QBank हमारा स्टार्ट कर देना चाहिए, बिकॉज इंडिया का एस अभी के लिए द ओनली क्लिनिकल QBank इज ऑफ PrepLadder right of now. So I think they should start with right now only. So what are your views about the QBank that you have solved it? Because I know you have devoted all of your time to QBank. That you solely relied on QBank before going to exam. So how did this go?
I have the highest opinion of the QBanks, honestly. Basically, the QBanks are there to consolidate your knowledge that you already have and clear your doubts. And if you review your mistakes and you read them through again, that, oh yeah, I made this mistake, I need to correct this, it's nothing can stop you. Basically, there is no exam that you cannot clear. So this is my opinion. And also, I want to briefly mention about the PrepLadder's image-based PDFs that they have. Just right before going to the exam, there are two things that I did. I think my exam was on Sunday, and while going, I had to travel a lot to the exam center. And I did two things. I gave one grand test right in my car as I was sitting. Okay. And one thing, the other thing I did was do the image based. I went through the image based PDF. I honestly, as much as I want this to be true, I did not review my questions right before the exam. I did it only sparingly throughout my preparation time.
But that is fine if you have reviewed it before also.
Yeah, but this is what I did. I did the grand test, one grand test. I was there. I think it was PrepLadder only. That was just a little bit before the exam time.
Okay.
And I reviewed that, the answers and everything, and I did that image-based question. And I would say this, that because of that image-based PDF, I could answer 3 questions.
So 3 questions were direct from the image.
Yeah, right. Exactly the same image was there inside.
So basically, you were thorough with the questions or the Q bank.
Yeah, and I did not leave a single question in the PrepLadder Q bank. I did in forensics, dermatology, psychiatry. I did not prepare the subjects. When I was attempting the PrepLadder Q bank, I knew absolutely zero about forensics. And after the Q bank, I was like, oh yeah, I know.
So how much time did you take in solving the whole Q bank? How much time did it took you?
That's from where I started my preparation till the end.
So around in 2-3 months you have completed the whole Q bank.
Yeah, very easily. Plus the grand test that I gave and plus the revision and everything. How I did it was that if I attempt the OBG Q bank in the morning, I would review surgery or internal medicine in the evening. The Q banks that I've already done. In the beginning, when I didn't really do any Q banks, I was doing 2-3 subjects together, so that my brain can switch between the subjects.
Yeah, this is very important.
Only did internal medicine, that I would be or pediatrics or something. I needed that switch, OBG, internal medicine, and something like pharmacology. That's completely theoretical. Or or something like surgery, and then pathology, and then one forensics or psychiatry or something like that. I needed that switch so that I can make the switch when I'm in the exam, because that exam is not FMGE is not surgery, internal medicine, and OBG. It's all together.
Just like the upcoming next. So people are together. We don't know if the first day is medicine, so we don't know if only medicine is asked. So many questions from physiology can be there, because now the students have the perception that we only have to study medicine and surgery. So I want you guys कि आप ये इनके दिमाग से निकाल दीजिए कि still उनको 19 subjects की importance पता होनी चाहिए कि for reading medicine they should know biochemistry to some extent, they should know physiology, they should know pathology.
I'll say something about this. The thing is, when you read the question, you don't know key question comes in.
Yeah.
There can be a surgical scenario. Oh, there was this 60-year-old lady for hernia repair and all that, and then peritonitis occurred. What antibiotic did you give? For example, just an example.
So it is an integrated question for surgery and pharmacology, right?
Surgery, pharmacology, and also what if it's about precision medicine, clinical pharmacology also, and internal medicine. You cannot once you read the question. Once you're sitting in the exam, a student might think, for example, you might think this is surgery, you might think this is internal medicine, and I might think something else. It does not matter. Study all your subjects.
And you need to know everything. You need to know what peritonitis is. You need to know what the treatment of is. If surgical component is asked, you need to know this. So it is not like you have cut down the syllabus to your half only, we'll read this only for the next. It is not like this, guys. You have to read everything.
Right? This is exactly what integrated means.
Yeah.
Everything is integrated. It's one medicine. It's not 19 subjects. You are doing one MBBS, one medicine.
Yeah. So finally, Dr. Balvinder, what is the take-home message that you would give to the students?
One take-home message for the ones who are going to give this July FMGE examination is that you have done enough hard work. It takes years to reach till this exam. Everyone, whenever we go abroad, we think of the day we will be writing FMGE exam, and that day is about to come. You have done so well in the past months and years, and this is the time to just show up in the exam how much you worked hard. Just revise. Don't read anything new. Just solve as many questions as possible, and there is still time. You can give 1 or 2 GTs, and just before the exam, every year, PrepLadder release some GTs like totally based on PYQs and image-based questions. Like, don't forget to attempt those GTs, because a lot of questions indirectly, or maybe 4 or 5 questions directly, are going to come in the exam from those last GTs. And the other advice I want to give to upcoming next exam aspirants is that don't look at these 19 subjects like 19 different subjects. As you can see in the draft, there is mentioned that first day is medicine and allied subjects. So there is no mention of the name, like what allied subjects. You just need to look at the 19 subjects integratedly. You can just study anything from that particular topic. Even if it is in medicine, just open again your pharma notes. You can look the drugs given in those diseases. You can just, for pathophysiology, I'm not using patho and physiology different words. You can just study the pathophysiology of that particular disease and just start thinking in that way, integrated.
You can get that magic number of 150 very easily. Just keep studying, keep hustling. Just revise your concepts, do image-based questions, do PYQs, do Q banks, do these things, and you will definitely get that score.
It is possible. You can do it. You will do it. Just trust yourself. And just make sure that your strategy is accurate. Even though you started late, your strategy can make a difference.
So thank you so much, guys. Thank you so much for sharing your wonderful experience. And you literally have inspired and motivated many of the FMG students who are about to give their exam. And also, not exam point of view, in generally also will give their exam next year or somewhat. So thank you so much. Thank you, Dr. Balvinder, Dr. Puneet, and Dr. Amulaya.
We would also like to thank you and PrepLadder as well, ma'am, for giving us this opportunity to help our juniors so that also can ace their exam.
Thank you so much.